FDA has asked that a boxed warning be added to the prescribing information for fluoroquinolone antibiotics. The warning will remind healthcare professionals that patients taking these drugs may experience an increased risk of tendonitis and tendon rupture. Fluoroquinolones include Cipro, Factive, Levaquin, Avalox, Noroxen, Floxin, and Proquin.
Wasn't there a warning already in the labeling about this?
There was, but FDA was concerned that there continued to be a large number of reports of tendon injuries coming in, and so the boxed warning will direct the physician's attention to this information, and that will affect the benefit-risk decisions that are made when this drug is prescribed.
Okay, well, certain patients are at greater risk for these problems and certain tendons are more likely to be affected.
The high-risk group includes those patients who are over 60, those patients who are taking corticosteroids, and those who have had transplants of the heart or lungs or kidney. As far as the tendons are concerned, the Achilles is the most commonly affected, but other tendons can be involved too, and that includes those in the rotator cuff, the biceps, the hand, and the thumb. And the risk isn't necessarily gone when the drug is stopped. Cases have been reported in which tendon problems occurred up to several months after the drug was discontinued. By the way, the increased risk of tendon problems applies only to patients who are getting fluoroquinolones systemically. Those taking eye drops or ear drops are not affected.
Now, we've been talking about tendon injury, but there are serious risks with these drugs besides that.
They're rare, but as you say, they are serious. They may include convulsions, hallucinations, depression, heart rhythm changes, and serious allergic reactions.
Back to the tendon-related risk. Fluoroquinolones are vital drugs in treating certain bacterial infections, so a practitioner may very well decide that the benefits in a particular case outweigh the risks. What then?
The key is to caution patients to watch out for inflammation, swelling, pain in a tendon area, because that could signal tendonitis, and also to know the signs and symptoms of a tendon rupture. If a patient experiences any of these things, they should avoid using or exercising that area of the body, stop the drug, and see their doctor about the possibility of switching to another type of antibiotic. It's important that patients understand what to look for and what to do, and so the FDA has asked the manufacturers of fluoroquinolones to develop a medication guide containing this information, and that's going to be given to the patient with each prescription.